accredited, so you'll get 1 hour of points for this. And of course, because it's CPD, I will just be talking about the science of hypothiocyanate. I will not be talking about my company or how to obtain the product or anything. That would have to wait until after we've finished the formal presentation. Okay, moving on from the introduction slide. What I'm going to talk about today is about us, which I will not be doing, as I just explained. Look at the healthcare crisis, make some comments. I have a nice little humorous view of the history of medicine. Then the immune system and where hypothiocyanate ion fits into the immune system. And then talk about clinical experiments that have taken place with this ion and the potential conditions that could benefit from its use. And then we'll have questions. One thing I would like to point out very clearly is that I'm not promoting hypothiocyanate as a cure for anything. It is not a cure for anything. The only thing that cures people is their own health, their own body, their own immune system, and of course, the way of life that they lead. So moving on then, beyond that and the disclaimer, this is who I am, Richard Stead. I am the Chief Executive of the Cures Group, which owns KIB Healthcare, and I was the person that developed the product and brought it to market. And that was some years ago. I started with the product to be used in the food industry because I was very concerned 10 to 15 years ago that too much chlorine was being used and to wash vegetables, fresh cut lettuce and so forth. And also in the United States, they used a lot of chlorine in washing things like chicken carcass and beef carcass and so forth. And it's something I really don't like, chlorine. It's extremely dangerous material and can cause some nasty side products, carcinogenic materials. So I was looking to replace chlorine, and it was very successful at doing that. I had better results than chlorine, and in every case, at least as good as chlorine, but it proved to be a bit expensive compared with chlorine. Chlorine costs next to nothing, and my product was about 5 times next to nothing. It would have put less than 1/10 of a penny onto a bag of lettuce, but over a year, that would have cost a processor something of the order of £60,000, and that was a cost that the likes of Tesco's and Sainsbury's were not prepared to bear on the cost of a bag, and the processors could not afford to invest that amount of money if they weren't going to get it back from the supermarkets. So I had to withdraw from the food industry, and but the technology was so clever, so good, so competent against pathogens that I decided to try and make a healthy product out of it. And that's how I have arrived with the product and how I've studied and followed and tried to let the world know what hypothiocyanate can do for people's health. We are in a healthcare crisis now, not just of COVID, but COVID has shown very clearly just how poor our general health is. If we look at the life expectancy, if you were born in 1981, as a male, you were expected to have an average life of 71 years. And out of those 71, you would have 64 and a bit good years and 6.5 poor years. Not always the last 6.5, but during your lifetime, you would have periods of bad health, averaging about 10% of your life, which is quite a lot. We started living longer. In 2002, our life expectancy is almost 75. And if you're born in 2016, which I'm sure many of you were, then you would have a life expectancy of about 80 years. But look how much bad health time you would have. 20% of your life would be on average in poor health. If we look at, and that's for males, if we look at females, the picture isn't any better. As ladies, you will live longer, but look at the amount of bad health. 19 years for somebody born 5 years ago. They can look forward to 83 years, but more than, what, a quarter of their life, they would have bad health as an average. We really need to do something. And when people talk about the pandemic and how to avoid the next pandemic, I think it's that one chart there shows me the way to do it. We've got to improve people's lifestyle. We've got to improve what they eat and how they live their life. Not so much sitting down. I mean, one of the big causes, I've looked a lot into our health since the last 150 years, prompted a lot by much of the work carried out by my good friend, Dr. Paul Clayton, when he talks about food and health, and he looks back at the Victorian era and how relatively healthy people were compared with how we are today. Much better health, but they didn't have many of the luxuries that we have. So something's got to be done. And I do believe that hypothiocyanate has a possibility to contribute to a much better lifestyle. So is our life better now than it was 50 years ago or 100 years ago? How do we measure better life? Longer life doesn't equal a better life. Not if 25% of our lifetime is spent in the throes of bad health. I think much of the modern medicines that we have are nothing more than medicines to keep us in poor health so that we keep taking the pills that the modern pharmaceutical companies want to give us. None of them are things that really cure us. They treat the symptoms, as we know. But what have been the causes of this bad health? Industrialization, processed food, agricultural techniques, the type of work that we do. If you think back 200 years ago, who had an office job? Who sat on their backsides all day long? We do. Well, some of us, I'm sure you don't all do that, but there are many people whose jobs, computer related or typists, we remember from 50 years ago, sat on their backsides, lack of activity. And activity, as we all know, is very important for our health. So the lifestyles, medical and health techniques, and the availability of these medical services. So as I promised, here's a short look at the history of medicine going back 3,000 years ago, 4,000 years ago, sorry, yes. When you were ill, somebody said, eat this root. Then we moved on to prayers, then superstition, so drink this potion. And then the potion is ineffective, and then penicillins came along and other antibiotics. Oops, the penicillin has mutated. So the bacteria can fight against it. Not the penicillin didn't mutate, sorry, the bacteria mutated and could stand up to the penicillin and others. And the bugs mutated again, take this other antibiotic. And 20 years ago, after more and more mutations, we were just taking stronger and stronger antibiotics. And viruses came along, and we know that antibiotics have no effect against viruses. But we're now back to eat this root. And I think they are right, as they were 4,000 years ago. It's our food that has far more effect upon our health than medicines can do. But there have been no new antibiotics since the 1980s. That's 40 years. And yet people are pouring lots and lots of money. The government is giving money, and they're giving the money to the same people who have not been able to do anything for 40 years. Do they really expect they can come up with an answer suddenly overnight? And there are almost no antibiotics in development at the moment. There are only 14 of novel, and I was reading an up-to-date report on antibiotic development from the Pew Trust, and there's about 4 that are still there. When I first prepared this slide, it was before many new antibiotic companies actually withdrew from the market. They closed down in bankruptcy because they were a new antibiotic, and the health people were holding on to those antibiotics for fear that they needed them because all the others were failing, and these were being kept as the last resort. So they weren't buying any. So the companies went into administration and have closed down. So there's not much future if we rely upon typical antibiotics. We are now coming into a very serious time when we can't rely upon antibiotics. I call it the post-biotic era, and brought about by our own foolishness, by using antibiotics too much, as we well know, into animals and so on and so forth. And so how do we survive this long when there's all these pathogens out there? We've always relied upon our own immune system. And our immune system is extraordinarily wide and competent. The sorts of things, when I started looking into it, I became amazed at how wide are the activities and actions of our bodies and the way our bodies are constructed to create this amazing immune system. There are 3 types of immune system: the physical, the chemical, and the biochemical. And I first read about this, I couldn't believe all these things that they were saying. But if we have a look, we have as physical, a cough. Cough throws stuff out. Vomiting throws stuff out that the body doesn't want. And we have eyelids to keep dust and so forth falling into our eyes. And it's this area that I was particularly interested in. And I was interested in the skin. I came from the food industry, and I spent a lot of time in the last 10 years, so that was at the end of last century, looking at natural materials and how they are used in nature and how can we adapt them to our food and our health. And the skin amazed me. It's it's the biggest organ that we have, huge, man, but it's a barrier. And other barriers are eyelashes, earwax, nasal hair. These are all things that capture and prevent or put walls to stop pathogens getting through. And our skin is our largest organ. It's a huge area. It's got many properties and functions, and it's a wonderful barrier, but it has got holes in it. The mouth, our eye socket, anus. And so I wanted to know what it was that the body in all mammals that was there to protect us with these open areas, these holes, that was as effective as the skin at keeping out pathogens. So looking at those three areas, and I identified what I didn't identify. I found through reading what other people had identified and seen was how clever the body was. Now, I want you to do some things for me. Close your eyes and just imagine that you have just cut your finger. What is your first reaction? Before you even think about it, what do? You put it into your mouth. You imagine, you do straight away. No question. I do it. So why do you put it there? Keep your eyes closed and imagine that you are 4 years old, just a few years ago for some of you. And you're running around and you fall over and you hurt yourself and you cut your knee. And what is your first reaction then? You don't put that into your mouth, but what do? You run to your mum. And what does she do? The cure-all for everything. Your mum will kiss it better. And she doesn't think about it. She kisses it better and you stop crying instantly because your mum has done that. They are what I call reflex actions. You don't think about it, you just get on and do it. So what is it then that's there? And why does your mother kiss it? And why do you put your finger in your mouth? Because of the immune and protective system that is in your saliva and in your tears, in your backside, in your vagina. What is it that's in there that protects these things and stops pathogens getting in? It's a tiny, tiny ion with a molecular weight of only 74. You imagine the huge molecular weight of some of the antibiotics, over thousands in terms, huge molecules. But this is a tiny molecule, OSCN, just 4 atoms with a molecular weight of 74. But it's the means to manufacture it are there in your saliva, in your tears at all times, but it doesn't exist. It only becomes a product, hypothiocyanate, when a pathogen arrives. And the pathogens are always exuding hydrogen peroxide. And hydrogen peroxide is one of the essential elements required to manufacture hypothiocyanate. The other two are thiocyanate and an enzyme, a peroxidase enzyme. And it's the enzyme in the presence of peroxide and thiocyanate that instantly catalyzes a reaction to make OSCN, hypothiocyanate. And that's what made me come up with the phrase, a phrase I've believed in for 20 years. Nature has the answer. Chemistry is the key. And that's what I followed. So I looked at the chemistry of this to understand it and how to make it. And that's what we have done. And now we talk a lot about hypothiocyanate and the answers that it can possibly be for pathogenic infections. Now, if we have a treatment for infections, here's a list of things that I've talked about that we would want from the perfect treatment. It's obviously got to be effective. And we'd like it to be fast acting and broad spectrum, so we don't need 50 different antibiotics, one each for every bacterial pathogen that there is. Resistance, we want that to be avoided. We know the problems of antibiotic resistance. So we don't want a new product that comes out and is just the same. We don't want something that's harmful to the friendly bacteria that we know is absolutely essential and very important for our overall health. It would be nice if it was effective against fungal and against viral, for which we know there are almost nothing as cures to kill and remove. We don't want any nasty side effects. We'd like it to be cost effective, must complement the immune system, not do any damage to the immune system, and it must be harmless to human cells. And so looking at the antimicrobials that we have around, which are antiviral or antifungal or antibacterial, this is how I score them. So with a mix and so forth, so it scores about just under half. Like effective, yes and no, some are effective, some are not. Effective against fungal, there's very little that is effective against fungal, but some are good at controlling the symptoms. And I'll come back to this chart a bit later. So hypothiocyanate, it's been known of for a long time, for at least 50 years. There are papers going back talking about the presence of hypothiocyanate in saliva and so forth. So it's not new. So why wasn't it available? Well, from my own experience, it's very difficult to make a delivery system. It can't be made in a bottle, like a syrup or just in water at a factory and then shipped out, because it's got a very short half-life. And within 2 hours of when it's been made, it's probably less than 50% effective. And therefore you can't make that in the factory. Before it's left the factory gate, it will have disappeared. It has to exist in liquid, so you can't make a tablet from it. And you can't make drops out of it because, again, it's just won't last long enough to leave the factory. So it has to be made at the point of use. So what is it effective against? In the body, it's there to protect, you imagine in your saliva, it's to protect against when you put your fingers in your mouth, or when there's some food that goes in, like a piece of lettuce that's not been washed very well, and it's got an E. coli on it, just the 1 or 3 E. coli organisms. So it must be effective against bacteria, gram positive and gram negative. And fungal, it is effective against fungal, against candida and herpes. And you'll see if I go backwards, you'll see there's references at the bottom of that slide that I've got listed, where people have written papers or articles about the efficacy of hypothiocyanate against a range of bacteria, pathogenic bacteria. And papers also against candida, against herpes. And also, we think of viruses. There's papers showing that it's very effective against type A, type B. Nobody's tried type C because type C viruses do not make us ill. It's very good against influenza. And we've tested it against coronaviruses, not COVID too. Those tests are not completed yet, but laboratory tests where we take COVID, where we take the coronavirus and other viruses, and we compare it up against other treatments, other antiviral treatments that we have, remdesivir and so forth. And it does work. it's very good at destroying these viruses. And there's a range of references down below. There are papers out saying that coronavirus, some of the beta coronaviruses that were not pathogenic, hypothiocyanate has been able to kill them. And there's no reason or anything in the structure of COVID or SARS-CoV-2 that would make it any less effective at destroying that virus than against any of the other coronaviruses. We have some work ongoing in laboratory, in vitro tests, and I was hoping that they would have been available by now, but they're not. So I can't say that in vitro tests it's been effective against COVID-19, sadly. So it's very effective. But then that's not surprising because nature designed it to do just this job. But what about the toxicology? There's a lot of information out there, scientific publications shows that it does no harm to human cells or to the friendly bacteria. There's no side effects. And one of the reasons is because the breakdown products, which will be the same as the original starting products, thiocyanate and oxygen, they are in the body all the time. One of the reasons you should be telling your children to eat their cabbage, or your grandmothers were saying eat the cabbage, and your vegetables is because that is where we absorb thiocyanate, and it's a very important thing. And I'm extrapolating now and making up 2 and 2 to make 5, but maybe the shortage of vegetables in our diet has left us short of thiocyanate to fight the likes of COVID. Maybe we should just eat thiocyanate, buy a bag of it and swallow. Well, there is information to say that too much thiocyanate can cause problems. But thiocyanate can be in saliva at big range, from 35 parts per million for non-smokers up to 200 parts per million for smokers. The thiocyanate that's created from smokers is because the inhalation, they inhale some cyanide and cyanide derivatives, and the body has an automatic system for converting cyanides into thiocyanate. So at high levels of thiocyanate, such as 200, there is no problem for humans. So thiocyanate was used many hundreds of years ago for blood pressure. And so we have old information talking about the lethal status, the toxicity, and side effects that can come from too much thiocyanate on every day or over a week or 2 days. And on the slide here, if you took 1,000 milligrams on a daily basis, of thiocyanate, you would start to feel really sick after a couple of days, and 4 days later, you would be dead. That's 1 kilo, which is a lot of thiocyanate. And this is where it's been published. In Eastern Europe, it was still being used as a treatment for blood pressure up until just about 20 years ago. But some modern treatments, other treatments came in and became more in favor of younger doctors who had forgotten older treatments like thiocyanate. But hypothiocyanate has been approved for its use in different parts of the world. The WHO have approved for it for use in milk and dairy products. And this was in particular for milk or farmers in hot countries such as Cuba, China, in Africa. You imagine Kenya, if a farmer who's a dairy farmer collects milk and the tanker lorry's got 5 or 6 hours in the middle of the day to travel to the milk processing plant, the temperature of that milk could rise, and also it could encourage the growth of spoilage organisms. So WHO, they did a lot of work, and they said add some thiocyanate, add some extra enzyme, and it gives the thiocyanate, gives the milk that stability and preventing the growth of spoilage organisms for several hours. In Australia and New Zealand, it's used on meat to fresh meat on the surface to stop spoilage organisms growing and converting the nice red, pink meat to stop them becoming brown, which they do in air. And in the US, the FDA has agreed to a GRAS status for the use of thiocyanate to make hypothiocyanate in some dairy products, some yogurts, some creme fraiche, and so forth. And within the EU and in the USA, hypothiocyanate use in some mouthwash and some cosmetic products and toothpaste is approved. So the safety is there. It's the amount that you take that could be a problem. And I'll come back to that later. So, clinical experience with hypothiocyanate. It's not an approved medicine anywhere, and nobody's sought to have it approved, which is why it is not yet approved. There was a GP in Eastern Europe who decided to use it. And the aim of his survey was to, first of all, prove the efficacy in vivo. In vitro tests, as we told you, with all the papers, numbers, and so forth that we indicated earlier, it's been shown to be very effective in killing virtually every pathogenic organism that was presented to it, it killed, whether that was viral, fungal, and bacterial. People often ask about parasites. I've seen stool reports of parasites before, and the stool report for afterwards, there's no parasite. When I mean afterwards treatment of using hypothiocyanate. I cannot understand how that is possible. The chemistry of hypothiocyanate says it's impossible. There's nothing there that can do something bad to a parasite. I can only think that the removal of other pathogenic materials doesn't suit the parasite, which might prefer to live in an unpleasant, dirty environment. Or maybe the immune system has become free to be able to concentrate on the parasite. Either way, I've seen lots of stool reports showing after OSCN treatment, the parasite has decided to leave. So that was the efficacy. And which clinical opportunities were there? Compare its efficacy with antibiotics and identify if there were any possible side effects. And there were 4 types of patient that came in to see this GP, and he was offered the solution of OSCN to the patient or an antibiotic. And there were 22 patients in that week and 22 successes. You can see the type of patient that they were: upper respiratory, pneumonia, soft tissue, and Helicobacter pylori. The same number of patients were chose to take antibiotics, and they were all successful as well. So hypothiocyanate proved to be as effective as antibiotics. And there we were talking only of bacterial effects. Although in upper respiratory, the chances are that they must have been viral, because upper respiratory infections, 80% of those are viral, even if doctors satisfy the patients by giving them an antibiotic, which won't do any good. So here's the table that I presented earlier, and what we want from a treatment for infections. So what can OSCN do for your patients and for you in trying to make them healthy? Well, papers galore proving its efficacy, and I'm beginning to show some laboratory work, and we've done some trials on autoimmune, but I'll come on to those later. It is fast acting and broad spectrum. It couldn't be broader, but then it must be broad because nature designed it to do this particular job. And I didn't design this molecule or invent it. I just developed the delivery systems. And resistance, we believe that resistance is not going to be possible. I'm sure I'm going to be wrong on saying that, but 99.999%. Because had these pathogenic organisms been able to develop resistance, then what's going on in our saliva will have not been effective. And we as a species probably would have died out, as would other mammals, such as dogs, pigs, or maybe that's what killed off the mammoths and the dinosaurs, I don't know. But maybe they didn't have hypothiocyanate in their immune system. It's not harmful to friendly bacteria. It doesn't damage DNA. It doesn't damage human cells. Cost effective? Well, depends your own view of cost effective, how much one should pay for a dose of this material compared with antibiotics. And antibiotics, as we know, are very cheap. You can get them for just £2 or £3 a strip of antibiotics. Or you can pay tens of thousands of pounds for a dose for some special conditions. So whatever price is paid for hypothiocyanate, it can be said to be too expensive or cheap, depending upon the circumstances. So we've carried out a first trial, clinical trial, where we had 120 patients with upper respiratory. We didn't do any clinical because we couldn't afford to. We just based it upon the doctor and the patient's description of symptoms. And we found, and the doctors determined if it was bacterial or viral, depending upon the symptoms. And we had 75% success in 24 hours of the 65 that returned. Sadly, as is the case, I'm sure you find, and GPs and hospitals in this country find, not enough people returned so that we could really assess the performance of our product. But what we found of the 65 that returned, 75% of them, 75% of them reckon that within 24 hours, their symptoms had reduced so much that they were ready to go back to work that day, 24 hours later. Typically, In the United States and in the UK, we find that people with an upper respiratory infection would be off work for 4, 5, 6 days, which is quite an expensive situation for the employer, for the employee themselves, and of course for the government with the treatments, the lack of production, and so forth. And here's a list of the summaries. Sorry, you might be able to read them if you get close to your screen, but here's what people have said: recovered in 2 days, recovered in 3 days, 1 dose or 2 dose. We had a good set of results. And there's a bit closer up picture, the sorts of things that the hospital doctors identified it as: bronchitis, rhinitis, a viral infection, a pharyngitis, and so forth. So what are the indications for the use of hypothiocyanate? Well, bacterial, fungal, and viral in all parts of the body. The dosing proposals, we think, are mathematical, is the easiest way to describe them. We break it into 3 categories: mild and recent, mild and persistent, or heavy and recent, and heavy and persistent, something that is really chronic. So like a flu, if flu came along, and if you get onto it early enough, a low dose would be needed on 1 day, maybe 2 days, depending how well your symptoms go down. Mild and persistent, or heavy and recent, that would mean you've got more infectious materials there. So you need a heavier dosing to get at. And always it's a case of where the OSCN will help the immune system bring things down. Sorry about that. Oh, sorry. Sorry about that. It wouldn't be switched off. Mild and persistent, it's got more infectious agents than the mild, therefore it needs more. And the heavy and persistent, and by that we mean somebody who might have had an ongoing E. coli poisoning that they picked up in Egypt. And the doctors have tried antibiotics, and the first course worked, but only a few weeks later, the problem returned because they hadn't destroyed enough. And it might have, so they tried another antibiotic, and they went through several courses. So there we would think you need to be taking dosing on 3 successive days to really hit the infections and hopefully bring it down to a level that is allows the immune system's competence to take over and control that infection. For COVID, we are doing some tests, as I told you, some in vitro, and I'm expecting the results very soon. We've had 1 verbatim result of somebody who's used our product. And they've treated COVID with OSCN. And you can read here how changed things. And after day 10, had they taken the hypothiocyanate earlier, as soon as they'd got a positive test, then they would have been a lot quicker. In this case, the patient, we didn't get the product to them until day 6, but in 3 days, 4 days, the hypothiocyanate had worked. And that was from somebody living in Hampshire. So what are the potential conditions? Autoimmune, and I've just completed a trial with doctors with utilizing hypothyroxine as one of the stages. And there's 3 stages that were in the protocol, but hypothyroxine was stage 1. And there were 11 patients in there. The trial is finished and I'm waiting for the official reports to come back. Sepsis, candida, gut dysbiosis, mental health, and those 3 with the stars, I would call them modern conditions, modern diseases. And there are pandemics of gut biosis, pandemics of mental health, pandemic of autoimmune. It's extraordinary. And many other conditions where pathogens are suspected of being present, maybe not the cure, but present. And so things like autoimmune disease, and if we think of multiple sclerosis, there are many times there are infections involved, not as a cause, but they are involved. People suffer with all sorts of infections, and maybe hypothyroxine will ease their problems by fighting against the pathogenic infections that are there, not to cure for multiple sclerosis, but certainly benefiting and helping these people so that the weight that's on the immune system is lessened, reduced substantially. I talked of mental problems. We hear that almost everybody that had a mental problem, depression, bipolar, autism, and so forth, they all seem to have bad guts. And it's unsure whether the bad gut causes the mental problem or the mental problem causes the bad gut, but the 2 almost always are there together. So pain, the discomfort, the mental discomfort that they have, and often toilet difficulties. And that's said to be linked with the gut-brain axis, the vagus nerve. And it's said that 80% of the work of the vagus nerve is sending a message from the gut to the brain. 20% of the messages are going in the other direction. So the stomach may well be a more influential element within that. And so if the gut can be better balanced, then maybe the mental state can be better balanced. But nobody's carried out any significant trials or anything in this area. So that the gut, and we read more and more nowadays that the gut is, if I call it formal medicine, the NHS and that sort of medicine, and the people that do research in that area, they have, within the last few years, discovered, to their amazement, that the gut is so influential on the rest of health. They have just discovered it, whereas nutritionists have known it since they started thinking about nutrition. But at least our mainstream health are identifying the absolute importance of the gut. And with COVID, we know lots of problems. And long COVID, as it's called, maybe that is something that starts from the gut getting into such a bad way when it's been invaded by COVID. So that's the chemistry behind hypothyroxine. And my phrase that I love to follow, nature has the answer, chemistry is the key. And I see that hypothiocyanate has applications outside of helping the immune system. We talked of milk, plants and agriculture to create a vapor and spread this vapor around plants in fields, maybe to put it into the air to fight airborne pathogens. We've heard how dangerous COVID has. Well, we can't breathe, we have to wear a mask. Can you imagine in a hospital waiting area, if we had this in the air, what it would do to any airborne or breath-borne pathogens? Food preservation. Oh, food preservation is twice as good. It's there twice, isn't it? Mouthwash, dental. There are many, many things where we can start to consider using hypothiocyanate, something that is natural and something that can be in the air and is not harmful to humans. So that is my take, my view of hypothiocyanate and its chemistry and its potential. And I think it's follows on from antibiotics. So it's the first postbiotic. That's my presentation completed. Thank you very much for listening. And I'll be very pleased to take any questions that you might have.
Great, thank you, Richard. We've had a few questions come through. So I'll ask the first one that's come from Catherine. When you were talking about OSCN not being approved as a medicine, is approving it something on your radar?
Yes, it is. We will be carrying out some studies on hamsters, which is the first step towards getting an approval for a proper trial. And that will start in about 6 to 8 weeks' time. And so it is my intention to try and get this product approved. What I want, because I believe it is so safe, I believe that it could be, should be allowed to be approved beyond hospitals and GPs, but maybe available not over the counter, but maybe behind the counter in a pharmacy and somewhere like that, so that it can be available that way, and hopefully through nutritionists as well. That's what we will be targeting.
Okay, great. And then when you were on the slide talking about clinical trials, there was a question about, is it just one treatment for parasites, and what does a treatment consist of? A series of days or weeks of OSCN?
Parasites, sorry if I didn't make it clear, I don't believe that my product does anything against parasites. I know that people have shown me reports where it's gone, but I would never ask people to buy my product or to use OSCN if they have parasitic infection.
Okay. Emma asks, how many doses for getting rid of Helicobacter pylori would you recommend?
Can I at this stage say that the formal presentation from BANT CPD is now at an end? As I said at the beginning, I cannot talk about my own company and my own product under the CPD. But now that the CPD is finished, I will happily answer questions such as what you have asked. My product is called KIB 500, and the 500 is because it has to be mixed up in 500 milliliters of water. I talked of dosing, mild and then persistent and then chronic. With mild, 1 or 2 doses should be enough. Helicobacter pylori, we've had mixed results. And that's because I think the pylori has a very good defense system. It creates ammonia, surrounds itself with ammonia, and stops the hypothiocyanate getting at it. But we've got a small protocol where using using charcoal for 2 or 3 days to absorb that ammonia before you then send in hypothiocyanate, and that tends to give us a better result. And that we got that protocol, and it's, I think, 2 doses of KIB on day 4 or something, with charcoal having been consumed to absorb the ammonia for 3 days beforehand.
Okay, great. Donna asks, how is it that good bacteria isn't affected, but unwanted pathogenic bacteria and viruses are?
Well, nature is very clever. They created this very effective ion to fight bacteria, but at the same time, it developed defense systems in the friendly bacteria, so that when the hypothiocyanate comes calling, the friendly bacteria can, with their own enzymes and systems that are inside, can fight off the OSCN, and it does no harm. It's the OSCN attacks pathogens and viruses on what is described on the outside cell wall, the sulfhydryl group, which is necessary for the transportation of metal ions, and particularly the balance between potassium and sodium, and also amino acids go through that. And when that grouping on the cell wall is damaged, those actions of amino acid transport and the balance of sodium and potassium can no longer take place, and the pathogenic cell, bacteria, just expires.
Okay, great. Gillian asked, is KIB suitable for people receiving chemotherapy treatment?
Yes, it is. It's quite good. Many people on chemotherapy or radiation therapy for cancers and other situations, they often have, for example, mouth ulcers. And that's because the quality of their saliva has been reduced. The enzymes that are in the saliva, the peroxidase enzymes, those are changed, reduced, and so hypothiocyanate is not created. And so taking KIB 500, it's very good to put in the mouth, and I would suggest hold it in the mouth, as I would if anybody's got any other mouth infection, for example, just after having had a tooth extracted or root canal or something. This would be a very good means of making sure no pathogens could get into the wound area. Yes.
Great, interesting. Okay, we have a question. As several doses are needed for most applications, the price is prohibitive. Would you consider offering a cheaper multi-pack?
Maybe I should. Maybe you are right. Yes. I thank you for that idea.
Okay, one to think about.
I will think about it. I don't promise to do it, but I will think about it. And maybe from buying on our site, then maybe you said, yes, £53 plus VAT is a lot of money. 4, which is a typical dosage for a strong infection, maybe that should be less than £200 plus VAT. Thank you for that. Thank you.
Great, thank you. And one question from Catherine again. I'm just going to read it as it's written. Given the status of not being licensed right now, I just want to check how it gets classified for us by nutritionists. I really want to use it, and I have, but it isn't a nutrient, so I'm a little unsure on BANT's stance, especially if they don't give CPD for you to talk about it. Do you have any guidance?
Just to clarify the last point, the CPD talks are on the science. And that's what I did. I talked on the science. I wasn't talking about KIB 500. I was talking about the science of hypothiocyanate, and that's why and that's what the CPD points were relating to. So BANT doesn't have anything negative to say about KIB, but they don't give CPD points when you're promoting your own product and company name.
And I'll just add to that and say that this has all been approved. We've sent this seminar to BANT and they've approved it. So from that side.
The classification is hard for me to find out exactly what it is because it's closer. It's not an approved or licensed medicine. It's at levels that are not toxic or harmful to humans or animals. The components are food additives. It's not a supplement. You have to mix it up yourself. So I'm not selling you hypothiocyanate. I'm selling you three things that come together to make it. I'm sorry to say, but I am unclear as to its group. Unclear as to its description.
Does that answer your question, Catherine? I can see you on screen. Yes, good. Okay, great. And Evie asked, is it still viable if it isn't put into the fridge straight away? Please, can you explain the methods needed to keep the product viable?
Yes, one of the components, one of the little bottles contains hydrogen peroxide, very low concentration. If you drank it as it is, it would be less concentrated than teeth whitening things that have peroxide in. But that is unstable over a long period, the hydrogen peroxide. And if it takes a week from when you order it from us until it's delivered, there'll be virtually no change in its concentration, no deterioration. But if people are going to hold that product in their bathroom cabinet or on their bathroom windowsill, then sunlight and warmth and so on could deteriorate the hydrogen peroxide. And that's why we say put it in the fridge where it's going to be dark and cold. But a few days from when we've made it to when you receive it will have no detrimental effect upon the peroxide or upon the performance of KIB 500. But we have to state it loud and clear on the pack, otherwise, well, we did have trouble before we were putting that on. So I didn't open the box, so I didn't know I had to put it in the fridge and so forth. So we asked people, put it in the fridge as soon as you receive it.
Great, and just there are some comments. Obviously, people have had some of the free kits that were sent out, and yes, it was because of us having you as a promotion contact. So, but if you haven't used it and you'd like to receive a free kit, in the email that comes out this afternoon, you can register for a free kit and you can get one. Even if you've registered before and you haven't used it, then please do let us know and we can get one sent out to you. So we've got two other questions. Evie says, could it be topically applied to wounds if you suggest it could be held in the mouth for ulcers?
Excuse me. Yes, it could. But it's like water and it would just roll off. What I think would be the way to do it would be to get some gauze, cotton gauze, and put that on the wound, and then pour the ready-made liquid onto the gauze, and then hold it there. Maybe you could wrap the arm, for example, with cling film. So that would keep it there. And I'm sure if it was there for half an hour or so, it would do a lot of good should there be any infection in the wound. Two things I will take the chance to mention now. One, hypothiocyanate is only effective when there's an infection. It does nothing else. The one task it's got is to fight pathogens. If there's no pathogens, it isn't there, it does nothing, and it just breaks down. And again, I will stress that this is not a cure for anything. I mean, whilst it might knock out a few, some pathogenic organisms, that doesn't make anybody healthy. It removes what might be a cause of bad health, but practitioners, nutritionists, really then have to make the patient healthy. And you know how to do that, but we will have removed the cause. We tend to think of a 5-step protocol where KIB 500 is the first step. Doesn't cure anything, but it gets rid of, say, the E. coli, or it gets rid of the candida, but the patient still has a bad health situation. So they have to be built up from there. We have some other products that are, first of all, prebiotic, and we've been out of stock because we couldn't get the right raw materials, but we're beginning manufacture within the next 2 or 3 weeks when the right raw materials arrive. And that's a great follow-up to KIB for the gut, for example, where having removed the bad stuff and only your own good, unique gut bacteria balance, you can feed those with these prebiotics. And then we have a new product coming out called KIB Biota, which is it's delivering the metabolites that normally the short chain fatty acids would be creating and releasing. And so we deliver those, and those are made by fermentation of organic herbs. And that's in bottles, and you drip those in, put drops into water and drink them. And that's proving to be, well, it should prove to be a very effective material. It's made for us in Eastern Europe, where it's proved to be very successful. And we have done, I talked of an autoimmune trial whereby we start off with the KIB, certain protocol for the KIB 500, and then we follow up for a month with the KIB Biota, the fermented herbs. And my report on that, I should be receiving that very soon. The work has been done, and I'm told it's been very successful, but until I can read exactly what has happened, I won't know the exact status of what, how people started, what sort of condition they were suffering from or had been diagnosed with, as to what's been achieved with them. But as soon as that's ready and available, we will get it sent out.
Great, thank you. And yes, we share that. And last question, do we stock it in the EU at all?
I do have some products in the EU, which I'd sent over there just in case we had difficulties because of Brexit and so forth. So I have got several hundred kits there. So if somebody wishes to access it from there, we can accommodate that for them. But they would need to write in an email or phone us, and we'll sort out what happens with that.
Fantastic. I think that is all of the questions, unless anyone has got any last minute ones they want to pop up, or either say or pop into the chat. But as I thank you all so much for attending. As I say, oh, there are a couple of other questions. So I'll just finish saying what I was going to say is that we'll send an email out with follow up with a link to the webinar, and also where you can register for a free kit and to get more information on KIB as a company as well. The other questions we've just had, do natural dispensaries store it in the fridge at their end? Do we know? And also the other question is, do we offer it on natural dispensary or any other platform?
It is available from Natural Dispensary. They don't keep it in a refrigerator, but they assure me that it's kept in a very cool warehouse. And that is more than enough. But we think, we talk of refrigerator for the users, only because most people don't have what I would say was a really old-fashioned larder, where they had a really cold surface on which they used to store meat and so forth. Most people keep their houses warm, and the cold place, therefore, has to be the fridge. So yes, it's available from a Natural Dispensary at, I believe, more or less the same price as we sell it at, and for a price that we would sell to practitioners also.
Fantastic. Okay. All right. Well, I will.
Can I just introduce one other thing? We do have another seminar that was given recently entitled From Dysbiosis to Rebiosis. And we talked there about the 5-step protocol for rebalancing the gut. So that is available. If anybody is interested in it, please write to Kate, and she will be able to give you the link to be able to watch it.
Yes, I'll put it on the email, so you can all have a look at that one as well. And you know, if that's one's of interest, then we can run that one again as well as a live session. Another question just come through: would this be suitable for someone on immune suppressants?
Yes, it would actually, because their immune system is compromised, deliberately so. But we would not, the hypothyroxine would not be affected by those immunosuppressants, but it would therefore truly boost their immune system and protect them against pathogens.
Fantastic. Great. Okay. So thank you, Evie. We will, as I say, any other questions, let us know. We'll be sending an email out this afternoon, so expect to see that coming through. And then, yes, it was lovely to have you all on here, and we will be in touch.
Thank you very much, and goodbye.
Thank you.
They don't want to go.